Good morning, everybody. Can you hear me? Yeah. I'll keep this rather brief because we've a long line after me. I'm the representative from the Royal College of Physicians on the Fit for Work Coalition. So I sit on the faculty board of the occupational health faculty. For me, I suppose I start with the premise that I'm a full-time jobbing occupational physician, and my premise is that work is good for people, and that retention and employment has overwhelmingly positive benefits, and that withdrawal and denial of employment by and large has negative consequences for people. So for me, that's the if you like, the agenda. That's where I come from, and it's well known to occupational physicians that the longer somebody is out of work, the likelihood of them returning to a productive re-engagement with their career diminishes. So certainly statistics like the average musculoskeletal is 22 weeks is worrying, because the likelihood of them returning at 22 weeks is so much less than if they were managed earlier. And therefore that brings on to the key premise for the Fit for Work is about early intervention. It's about engaging with individuals at the earliest opportunity to facilitate the management of their complaints, in this instance musculoskeletal complaints, to liaise with their doctors and their employer to increase the likelihood of the return to work and the management of their medical complaints within the context of work. And that doesn't necessarily involve a lot of high tech. Often it comes back to issues such as culture and behaviour, and working with employers to provide modest accommodations, working with individuals, with their doctors, to put on the agenda the outcome, which would be a return to work. In my experience, it's best done in a collaborative setting. So it's when a company has a sort of a broad approach to the management of these matters, including a HR approach, a line management approach, engaging with with their occupational health services. So some of the examples that were referenced earlier on were companies where we have some involvement. So we see where you put in place that sort of structured early intervention program, that the outcome's very positive, and what they talk about there is the outcome in hard pound, shillings and pence. But when we go back and we ask the line managers and the employees who have been, if you like, through that service, what their personal experience is, it's overwhelmingly positive. They very much appreciate the intervention, and aside from the hard, if you like, return on the investment, there's certainly there's a win-win from the employee's perspective and the employee's perspective. So I think the Fit for Work agenda provides a really interesting opportunity to look at some of those examples of best practice and put in place a national programme, which will be about rolling out a network of case managers who will engage with individuals at the earliest opportunity. So for me, as an occupational physician, I think it's an exciting opportunity because of the breadth of stakeholders that are involved in the process. So I think that's
Thank you very
probably
much,
my position,
Robert. Yep.